BRVO is a short form of branch retinal vein occlusion. That means a branch of the central retinal vein that is spread all over the retina and in occlusion to any one of the branch, that is known as BRVO. And the reason is many. So many reasons may develop this condition, just like the central venous occlusion. And he is lucky if it is only in one branch, that's all the difference. Any main reason or the etiological factors are either high level cholesterol or these platelet disorders or some calcium deposits, etc., just like in other occlusion. So this may be vascular change or due to the cardiac problems. So anyway, if there is a block that will develop this BRVO, the main symptom or the main sign will be hemorrhage. If there is a block to one drainage system, there will be leakage in the other side. That will lead to a very characteristic nature of bleeding or hemorrhage will be there. That is easily identified, that can be detected by an ophthalmoscope itself, and it is not a tedious thing to find out whether there is hemorrhage in the eye. And the bad side is that if there is a hemorrhage, there will be hypoxic areas also. Then the vision will be affected. And sometimes if the branch is in peripheral, most often it happens in the peripheral side only. If it is a central vein, it will be spread all over the eye and sudden loss of vision in a vast area. Sometimes total area may be the result, but in branch occlusion, it happens in the minute vessels that always lies in the peripheral area. So the loss of peripheral vision, any particular may be superior or inferior or temporal or nasal side where the occlusion happens, that side vision may be affected. And this hypoxia, when hypoxia happens, usually what happens, there will be development of collateral vessels to solve the problem. So in many cases it is seen that it may absorb or may get it subsided by itself. If it is small hemorrhages and small blockage, it will be getting resolved by itself. And if it is not happening like that, the body will take a mechanism by developing collateral vessels. Small vessels will be just like in any other part of our body. If there is a wound, the circulation to other parts, to the other side of the wound will be stopped. But it will not be stopped forever. There will be development of or created from the proximal end of the vessel, and it will encroach the other side and the circulation will be re-established. This will happen any part of our body, also in the retinal vessels. So what happens, these vessels will be very delicate or more thin or not strong enough as previous. So the bleeding will again happen. That is another situation. So development of new vessels, neovascularization will be a positive sign, but later it may bring some other complication. Neovascularization, retina will be damaged in some cases. So these are the sequelae, so the situations what happens in a venous occlusion. If we analyze the situation on the basis of Ayurvedic theory, we have to consider two factors seriously, because the vessels and blood is always confined to Pitta, and any blockage, it is a materialized thing, and any blockage is due to the vitiation of Kapha. If it is a massive block, then in such conditions we have to consider Pitta and Kapha. There is another block where there will be contraction of the vessels, that is very rare. even though it may happen, some spastic or contraction of the vessels also will bring out some blockage. In such a situation only we have to consider Vata also, where there is contraction and spasm of the vessels and blockage is developed, then only we have to consider Vata. Otherwise, the most important factors to be considered are Pitta and Kapha. So, here it is not an easy task to handle the case, because if we, in the case of dissolving the blockage, that means it will come under the treatment theory of Shodhana Chilsa. That means to drain out the unwanted things, whatever it may be, whether it is a pathogen or a toxin or accumulation or exit, whatever it may be, if you have to melt it or drain it out, that type of treatment is known as Shodhana Chilsa. So here we have to do that type of treatment to remove the block. So that type of treatment, if there is a hemorrhage, suppose as a part of this blockage there is hemorrhage, if you are doing this type of Shodhana Chilsa, there will be a tendency of hemorrhage again. It will be thinning the blood or dilating the vessels. So a tendency of bleeding will be again happening. So the treatment should be very careful. But it is possible. So what is to be done in the first stage is to maintain the circulation or to maintain the vascularity of the retina, so that further accumulation or further bleeding will be, the possibility will be less. That type of an approach is very effective or necessary for the treatment. Then only this Pitta can be controlled. Pitta is having the property of flow. In Ayurveda we say Sara Drava, like that, which is flowing in nature. So we to control Pitta in this condition is to control or to bring back the property of this Sara, that means flowing nature. That should be the treatment basis. So these two, to bring back the Sara property of the Pitta and to dissolve or to have the Shodhana of Kapha. These, if you are doing these two treatment or the steps to solve these two conditions, the treatment is successful. Then side by side, the natural mechanism of the body to absorb the things, to absorb the leak or the blood which is already leaked, it will be absorbed by itself to some extent. And by these two methods, Shodhana of the Kapha and also maintaining the property of Pitta by medications, these two things will bring back the system to normal. Since this is a blockage in the venous system, we have to consider so many other factors also. This may happen any part of the body, any time, any organ, like that. The block may happen in this nervous, brain, or in the cardiac system, or in the kidney, or wherever it may be. So to maintain the circulation is the most important factor in the treatment of any blockage. Otherwise it will happen in some other parts. For that, some factors, some restrictions or some simple medications are absolutely necessary. Just like thinning of the blood, that is one method, but we adapt not the thinning of the blood, not to make any change in the blood structure, but to make the flow normal. For that, we maintain this vascular structure or the vessel walls. That type of treatments are in Ayurveda. That will help to avoid further blockage. Otherwise, what will happen? This blockage will, once that locally it is solved, it will happen again. Recurrence is very common either in the same parts or same structure eye or any other part of the body. That is why when there is some BRVO or some other venous occlusions in the eye, you will be referred to a cardiologist also, whether there is any problem in the cardiac system or kind of problems like that. We have to rule out that. For that, in Ayurveda, we are adapting some method to maintain the circulation in its normal way. That means anilomana like that. And there is one factor we have to remember, that is Vyana Vayu in this concern. That is, Vyana Vayu is the seat of this. Vyana Vayu is a fraction of Vata. There are three factors: Vata, Pitta, Kapha, everybody knows. And one among these Vata is fraction is Vyana Vayu, and the seat is said to be in the heart, and it is running all over the body. So, to maintain the circulation or to maintain the normal flow of the blood is the function of Vata also. Then we have to maintain or bring the properties of this Vyana Vayu to normal is a part of the treatment. So, in this part we have to consider Vata, Vyana Vayu and also Pitta. Pitta is always the main factor in blood and its circulation. So, we have to control this Pitta and Vyana Vayu to make the circulation normal. That type of treatment procedures should be done to avoid further blockages. That is possible in Ayurveda. Most often it is possible only by oral medications alone. And periodical maintenance will give good result also, because our body will be having some problems by its continuous works, and also due to its various types of unwanted this works that is been done like that. So, to maintain it, some procedures should be done to bring the system back to its working condition. That is the actual treatments in the case of blockages. So, in the treatment of BRVO, we have to consider the first level treatments, which will be more focused on the ocular or ophthalmic level of treatments. That should be done in the hospital under the monitoring and the supervision of an expert hands. After that, to maintain the situation, he has to follow some simple medications at home, and this will protect his vision and will avoid further blockages in any part of the body. That will give good results.